Hi, my name is Glenn Morgan, and once again we're doing another lockdown, Governor Inslee's broadcast here when everybody's supposed to be locked in their houses, worried about COVID-19 and whether they're going to catch it or not. And with me today is Joel Ard, and Joel Ard is a constitutional attorney who also specializes in interviewing expert witnesses and scientists. And he's got quite a good background for analyzing and looking at Governor Inslee's policies. And Joel, I just want to thank you for being here today. And we'll be violating Governor Inslee's social distancing rules and talking about COVID-19 and the impact in Washington State. And I think maybe to start out with here, if we knew 6 weeks ago what we know now, how would things be different from your perspective?
Well, it looks as though things are a lot better than we expected them to be 6 weeks ago, and that's great news. And when Governor Inslee ordered the shutdown, we were all looking at a variety of predictive models from University of Washington and University College London and other epidemiologists that suggested this disease was brand new, just being introduced to the population, spreading very rapidly, spreading through aerosols, so it's a little bit harder to control. And also that it was very, very serious, and that quite a lot of people who got it would get very, very sick and need a lot of health care. And so the reasons given for that shutdown order were to protect the healthcare system. And everybody remembers flattening the curve. The curve being how fast everybody gets infected. And so the idea behind the shutdown was if we don't shut down, everybody's going to get infected. Everybody's going to need, a lot of those people are going to need a lot of health care, and it'll overwhelm the hospital system. We won't have ICU beds. We won't have ventilators. Our doctors will all be worked to the bone. And we need to flatten the curve, which wasn't going to change at all the number of people who got infected and not even the number of people who got seriously ill. It was just that we'd have healthcare resources available to them when it happened. Well, we all know what's happened. We haven't been strained at all in our healthcare resources. We had a field hospital built at the sports stadium downtown. The Army took that back because we didn't need it. We sent 500 respirators to New York because they really did need them, and it turns out we didn't. And all the predictive models have over time gotten lower and lower and lower and lower in their predictions of how many healthcare beds will be needed and how many ventilators. If you look at the IHME models today, which is the University of Washington group, they say we're 21 days past peak infection, 21 days past peak use of hospital resources, and they predict absolutely no shortage of ICU beds, ventilators, or anything else. We never got there. And so if we knew 6 weeks ago that the disease was maybe more prevalent, that it was certainly some very bad cases, but a lot of cases wouldn't be that bad, and that we wouldn't need an Army hospital and wouldn't need tens of thousands of ventilators, I'm not sure the governor would have been justified or would have even attempted to order such a massive lockdown of the state if he'd had to come out and say, I'm going to order the entire state to get locked down over a disease that lots of people already have and very few people will die from.
Now, let's talk about that, because that's directly impacting, I think, the shifting goals that we're seeing from the governor. And let's talk about that.
Absolutely.
And how that, from your perspective, how that's kind of impacting policy and people and the law,
Yeah, well, obviously the governor, the state government, and the governor as the chief executive of the state has a lot of authority in the areas of public health to, in fact, order lockdowns. And so, people call me and say, well, don't I have a First Amendment right to go to church? And don't I have all these rights? Yes, you do, but the state in emergencies can infringe on those rights. But the infringement on the rights needs to be rationally related to a public policy that is properly held by the state. And so when they start and say, look, we look at Italy, and it looks like this virus spreads very rapidly in large crowds. We look at a church north of Seattle where they had a choir practice and a lot of people got sick in a hurry. You say this data suggests that gathering in large crowds, like churches, is going to spread the disease very rapidly. Okay, well, you say, well, maybe people can decide to go to church or not. The public policy goal is we need to protect the ability of the state to provide health care to everybody in the state. If everybody gets sick really suddenly and all the hospitals are overwhelmed, then people who would otherwise be able to get the kind of health care they need won't be able to. And so we can order these infringements on your civil liberties and constitutional rights as a way of protecting everybody in the state. When you start to discover that's not happening, Governor Inslee has changed what he's up to. And just driving down here today, all the signs on the highway say, keep staying home, it's saving lives.
Right.
Well, that wasn't the goal at the outset. And not that saving lives isn't laudatory, but it's not the only thing that the state should be concerned about. And in fact, the numbers don't even really bear that out. So he's shifted the goalposts from protecting the ability of the state to have a functioning healthcare system to saving lives exclusively from dying from this coronavirus.
And, and a lot of the decisions that it looks like Inslee and anybody else is going to have to make on this, it's based on what the experts, they say, I'm relying on science, I'm relying on experts, right? They always say that. So looking at that, what's really the difference between an expert and an ideologue, when you're actually looking at it, because you have policymakers who are not necessarily experts. So what's the difference between an expert and an ideologue in this kind of a setting?
I think in virtually any setting, the easiest way to say it is an expert is someone who, given different inputs, will come out with different outputs. And we see that, right? I mean, I think IHME has come in for a lot of criticism about their models, but one of the reasons their models have gone down drastically over time is that they have different inputs. They've got estimates they make about how widespread is the virus already, how transmissible is it, how long does it survive in the air, if you get it, how sick will you get, if you get really sick, what will happen to you. They've changed those inputs into the models because we've gotten more and more data over the weeks and months since this started. And so the models keep getting lower and lower. That's a good thing, right? You have different inputs, you get different outputs. It doesn't appear to be as bad as we thought. The models are putting out things that aren't as bad as we thought. Unfortunately, it appears to me, when the models were up here and the lockdown order was here, well, the models have plummeted to here and the lockdown order remains the same.
And so the decisions then, I guess, in that situation, we're really talking about ideological decisions now that are being made, not really based on expert data.
Well, that's a very good question. The governor acts like he's relying on experts and likes to sound very sciencey about what he's doing, but it's not really at all clear what the goal of the shutdown is. And really on most of the terms he offers, it doesn't add up.
Right. And let's talk about, you'd mentioned population, the impact of this disease on populations, for example.
Right, and there's great data on this available from certainly Minnesota, New York, some other states. Mm-hmm. It's, for whatever reason, that data is not as readily available here in the state of Washington.
Right, this has been a problem. I wrote an article about it in Thurston County where they're just kind of, they're really discouraging providing information that's very specific on the populations that are being impacted by the disease,
right,
which is unfortunate.
We do know age cohorts.
Mm-hmm.
As of yesterday's data, I pulled it up before I came down. We had a little bit under 800 deaths. I can't remember if it was 796 or 769, but over 750 and under 800 deaths. Over half of them are people over the age of 80. Right. One thing we see in other states is that an enormous percentage of these deaths are people who are in assisted care facilities. Right. So those tend to be people who are not only old, but have significant other health problems, right, and they're living in fairly close quarters with one another. So that's certainly a very high risk, vulnerable population. The next biggest group of deaths in the state of Washington are people between the ages of 60 and 79. Mm-hmm. And that's a pretty broad range and generic one, not to be giving us data that slices and dices that more finely. And again, another thing that we've seen in a lot of data from other states and around the world is that the vast majority of people dying with this virus, mm-hmm, are dying not only with this virus, but with other serious kinds of illnesses, diabetes, heart disease, history of heavy smoking, those kinds of issues. So that ought to be able to guide us into how to protect vulnerable populations from the disease without negatively affecting everybody else. One group that we're clearly negatively affecting is people from the age of 0 to 19, of whom absolutely none in the state of Washington have died from this disease. So the younger you are, the less likely this is to have any serious impact on you. The older you are, the more likely it is to have a serious impact on you. And yet our policy is a bludgeon over all of that, which doesn't, to me, rationally relate to what we have since learned about the disease itself.
Right. Okay, so that lends it really to this discussion really leading right into education, because we've shut all the schools down.
We have.
And yet that population's probably the least vulnerable to this disease. So, I mean, from a public policy standpoint, let's talk about how that, with the data we have now, does that even make sense?
It makes absolutely no sense to me. Certainly the student age population itself appears to be at extraordinarily low risk unless you're someone who has other illnesses. And of course, we absolutely should take care of those children, but not at the expense of the education of everyone else.
Somebody with extreme asthma maybe, or just
absolutely.
Some other, if they're in cancer or treatment or something like that, sure.
Then talk about the teachers. For the most part, they look to be age cohorts, again, 80 and up at high risk. There's not a lot of 80-year-old teachers in Washington schools. 60 to 79, higher risk. Maybe you have some teachers in that age cohort who might be at risk. But for the most part, it appears that the students and teachers in the state of Washington are at extremely low risk of any adverse effect from this virus, even if they contracted it. And yet we've shut down all the schools. Right. And that is, we know that that's going to have a terribly negative impact on students. The other thing I think we can rationally predict right now is that that impact is going to fall more heavily on poor students in the state. If you don't have a good computer at home, don't have internet access, don't have Wi-Fi, et cetera, what are you doing for school? And so school districts that have already given all their kids computers and everybody's got home Wi-Fi, sure, they're going to maybe continue learning, but we have already seen that disparate effect through the state, where some school districts are offering quite a lot of online classes and online learning, and other districts simply aren't able to do it.
And in Seattle, you get an A no matter what. So the Seattle
all
school
the children
district,
are above average.
Yeah, exactly. Well, now, and this also leads to kind of another point about, and you've mentioned this before in the past, where like the medical system is being substantially impacted because all elective surgeries and cancer screening, everything's just been ground to a halt.
Yes.
And they're selling this to us, the whole lockdown, as we're saving lives. But talk about how that's impacting probably that whole argument.
That's another place where two terrible impacts, and both absolutely contradictory to both the original goal to shut down and the newly discovered goal of saving lives. Right. The original goal was save the medical system. Right. Hospitals everywhere are going to be completely overwhelmed. We don't have enough ICU beds. We don't have enough hospital space. We don't have enough ventilators, et cetera, et cetera. Thank God that didn't happen. Right. But we shut down hospitals from doing elective surgeries. And elective surgeries is a very broad range of healthcare treatment. It's basically anything not scheduled in advance, more or less falls under elective. So if you are in a car accident, you're dragged into the hospital, it's emergency. Right. And that's kind of the break. There's emergency, there's elective. But elective surgeries cover a lot of really vitally important health care to individuals. They're also revenue for hospitals. Right. So hospitals all over Eastern Washington,
big layout,
where there's practically no cases, but even on the western side of the state, we've got empty hospital beds, laid off hospital workers, radical declines in revenue to hospitals, because we were anticipating an overwhelming wave of COVID-19 patients that didn't materialize. Right. So the hospitals are suffering financially. They're not wildly lucrative enterprises that have massive stockpiles of cash to survive that. Their workers are getting laid off. Their doctors are not performing surgeries to keep their skills sharp. But then what about people who aren't getting cancer screening, aren't getting hip replacements, aren't getting knee replacements? Right. We know exactly what happens to the public health of the state with more provision of health care versus less provision of health care. And overall outcomes, longevity, life of the state is better with more provision of needed health care, and we've turned all that off. So it's not that hard to find the experts and the statistical models that will tell you the overall decline in life expectancy of people in the state of Washington as a result of shutting down elective health care.
Right. And I think that's where we're just doing this to save lives argument really starts to fall down, is that you're not, people will be suffering and dying explicitly as a result of these policies as well.
It falls apart. So that's one way it falls apart.
Sure, yeah.
Next way, every expert on epidemiology has said there'll be a second wave.
Right.
This is what happens with viral respiratory illnesses.
Right.
One winter, they kind of go away in the summer, they come back in the fall. So when Inslee said on April 9th that if we lift the shutdown, he had a little predictive spike, these people will die, he called them preventable deaths.
Right.
The trouble is, the models that I've heard of and read and seen, and maybe he's got a different one, is that there's likely to be a second wave, and so they're not prevented, they're just delayed.
Right.
The other thing we know, and there's ample social science on this over the course of decades, that very unfortunately, the higher the unemployment rate, the higher the suicide rate.
Right, I've seen those different studies that have shown that, and we're looking at a cataclysmic.
Absolutely tied together, and with cataclysmic unemployment, we can unfortunately guarantee that there are going to be increased deaths of despair, suicide, and the like as a result of this. And so, if you say, we want to save Joel's life, there's a disease coming and it will kill only Joel. Let's shut down the entire state for 2.5 years until we have a vaccine to save Joel's life. Look, I appreciate that myself, but that is not the kind of public policy trade-off that we should be making. And unfortunately, that's an extreme example, but that's really what we're doing here, is we're saying we've got a very at-risk cohort of aged and ailing people, and to extend their lives by a certain number of months or years, we're going to shut down the entire state and cause great harm to everyone else. There are easier ways to protect the health of the at-risk cohort in Washington state, and the ways we've chosen simply don't add up on their own terms.
And that leads to a couple of things. Disparate treatment was one of them, in the way that the governor's approach this policy, treating people, different people differently, and which I think is logically rolls into your knowledge on constitutional law as well.
Right.
So can you talk about that for the listeners as well?
Absolutely. I mean, there are legitimate reasons to treat people differently, even with respect to fundamental rights. If your church had a rat infestation, or somebody poisoned the altar wine, the state can tell you, no, you can't go to church today, or no, you can't have wine as part of your Eucharist celebration, or at least you have to buy some new stuff.
Right.
So yes, if there's a public health problem, you can focus on solving that problem, which results in treating similarly situated people differently. We say, there's a public health problem, and gathering in large groups is spreading this public health problem to the detriment of the state. We're going to ask the restaurants to close, but people still have to eat, so we'll leave the grocery stores open.
Right.
That is legitimate if it fits the problem, and the disparate treatment is going to be directed towards solving that problem. But if you say, it's dangerous for people to be in large groups and around one another, and so we're going to shut down construction sites unless it's the Key Arena.
Right.
Building the Key Arena is nice, but it doesn't really have much to do with solving the health crisis that we thought was facing the state. And so that kind of disparate treatment is not rationally related to the identified problem, and that's where you say, there's a constitutional problem of saying that I can't go to work in the same way that that person can go to work, when there's no difference between us in terms of the actual public health problem you've identified.
And this is that whole idea of identifying essential workers versus non-essential workers, even if they basically do the same thing. And so, from your perspective, looking at what Inslee's done, what are the constitutional issues that you would be most concerned about so far?
Again, I would say the longer you keep going with this and the more data you have, the less it's related to reality. And that's really the problem. When you start and you say, what if you said,
millions of people are going to die,
we have an asteroid headed towards the Earth, and the solution is we're going to launch 10,000 nuclear weapons and blow it up. And 2 weeks later, the scientists show up and say, great news, we've recalculated the track, it's going to miss. Don't launch the weapons.
Right.
That's easy. You need to change course. Right. That's what we had at the outset. This asteroid's going to hit us quick. We have to shut everything down so that we don't overwhelm our healthcare system. Well, that missed us.
Right. That's
a good thing. But now you're starting to see that the shutdown order is being lifted bit by bit. I don't think there's a very good explanation for why it's in place anymore at all. And we're seeing the bits that are being lifted might become more closely related to the governor picking winners and losers rather than tracking actual threats to the public health of the citizens of the state of Washington.
So when we're talking about picking winners and losers, the other thing is they've been really emphasizing some of these studies. Some of the study information has come out now. And why don't you address that issue?
Yeah, it's interesting. These are serology studies or antibody studies trying to find out who has been infected. And I'm not going to say these studies are perfect by any means, but none of the data we have on COVID-19 is perfect. It'll get better as time goes on. But they're certainly very interesting. Some of the very good ones, early on, it turns out the Diamond Princess cruise line is a great model. It's generally an older age cohort, the people who are more at risk. They're trapped on this boat for a long stretch of time. And afterwards, there were studies about how many people were infected, which tells you, to a certain extent, how infectious the disease is. How much does it spread? And that's an important factor to know in making public policy decisions. We're seeing similar data from the USS Theodore Roosevelt. Presumably that data is, there might be some national security issues about whether they're releasing that, whereas the Diamond Princess cruise line information I think was pretty solid. We also saw a study of women who presented for childbirth at New York hospitals. So they're no COVID symptoms, they're just showing up to give birth. And they did blood tests and found out that, if I recall correctly, a third, a half of them had antibodies. So with no symptoms, they'd been exposed. And there's a group of professors at Stanford and USC who did similar studies in Santa Clara County, California, and then again in Los Angeles County. And the Santa Clara one, we're asking for volunteers, so it's a little less random. Los Angeles, they tried to make it a little bit more of a random study. How many people have been infected? Right. It turns out it's a lot more than anybody thought. And that's actually great news. So there was an op-ed in or an editorial in the Seattle Times today sort of criticizing this. Well, we can't have, we don't know whether you can get reinfected. That's true, but that's beside the point. We started the shutdown with the understanding that something like 2 or 3 or 4% of people who were infected with this disease would die from it. Right. Which is a very, very high death rate for an infectious disease. By contrast, the seasonal flu is usually estimated at 1/10 of 1%, 1 in 1,000. Well, the infection death rate is a very important metric, and you can't use case death rate. You show up and say, I have symptoms, and then they test you and find out you're positive, and then you die. That's a case. Right. But most people, it appears, who got infected with this are asymptomatic, or symptoms are so mild that they never show up and solicit health care and never get diagnosed. Right. That means you can make a bigger denominator, and that means the fraction's not nearly so bad. What's the actual infectious death rate of the COVID-19 virus? Some of these studies are suggesting it's actually lower than the seasonal flu. Right. Now, it appears to be hitting older cohorts a lot harder than the seasonal flu does, but it's hitting younger cohorts a lot less than the seasonal flu does. If that's right, compare like to like on these terms. This is not something we do every January for the seasonal flu. We don't shut the economy down for 6 to 8 weeks every year for a viral infection transmitted by aerosol, breathing and the like, that kills about 1 in 1,000 of people it infects. We have that happen to us every single year. Right. As it turns out, these antibody tests seem to be revealing that we're facing the same kind of thing, a viral infection spread by breathing that widely infects the populace and kills about 1 in 1,000 people it infects. If that's it, from terms of public policy, not from a medical perspective. Right. Medical perspective, do things differently. From a public policy perspective, generically, you ought to be treating it the same way you treat other diseases that have that effect.
Right.
Except with respect to the very high at-risk groups of older people in nursing homes and people who have specific existing illnesses that are going to be greatly exacerbated by this infection.
Right, or conditions if they're
treat those
obese
people
and,
separately and appropriately, and for the rest of us, this should be just like any other seasonal viral infection that behaves in this way.
So now you've seen the Inslee does his press conference and his press, and it's been a moving target. You never know what he's going to talk about next. Is he gonna let fishing be allowed or hiking be allowed or whatever? If you were there instead of kind of the tame media that he kind of is faced with now most of the time, but you had a couple of questions that you would ask him. Specifically, what questions would you want Governor Inslee to answer in this situation?
I think there's two that he ought to be able to answer immediately to the satisfaction of everybody in Washington. Are there any predictive models today that account for new data on infection rates and show that there's a threat of overwhelming hospitals with a healthcare system if we lift this lockdown immediately and entirely? That was the basis for starting it. That should be the basis for ending it. We've put new data into the models. We're seeing new predictions come out of them. If we lifted this lockdown completely and entirely today, would the healthcare system get overwhelmed? I think the answer is no. And so the reason he gave for starting this lockdown has dissipated, and it shouldn't continue.
Which is why he's changing the reasons now.
Exactly, and again, those reasons don't hold up under any scrutiny.
Right.
The other thing is, we've been told that this is an aerosol-borne virus that probably doesn't survive very well in heat and sunlight, and so that's, again, like other aerosol-borne viruses we encounter. It will be higher in the winter and lower in the summer, and it'll come back in the fall. We've been repeatedly told that absent a vaccine, there will be a second wave. Okay, well, if a second wave starts, Governor Inslee, what will your metrics be for deciding to order a shutdown and ending a shutdown?
Right.
Why will you start it? Why will you end it? And will you make those public now so that we all know before you start when it will happen, why it will happen, and when it will end?
Well, it'd be nice if perhaps somebody in the media would hear these and ask these questions. Joel, I want to thank you so much for being willing to chat with me about this, and hopefully our listeners today will get a chance to hear what you have to say, and hopefully it's not what they've been hearing elsewhere, and I know it isn't, because you and I are looking at the same stuff I think everyone else is, and hopefully we'll be able to get through this thing and maybe fix some of these policy deficiencies that we're seeing out there, both I think from the lack of oversight or constitutional restrictions that our governor's been operating under. So with that, Joel, thank you so much.
Great pleasure. Thank you.
Yeah, thank you.